Tonight, it is all but certain after a vote in Congress today that those Obamacare subsidies will expire in January, sending insurance premiums skyrocketing for millions of Americans. Instead, House Republicans passed their version of a health care bill that leaves out those subsidies, but it came after a rebellion from some of them on the matter. 4 Republicans joined Democrats and signed a discharge petition to force a vote on a 3-year extension of the ACA subsidies. Johnson says that vote will happen in January, and again, that will be after the subsidies expire. Now, some Republicans on either side of that issue are questioning the way Johnson handled the matter.
You say no to the speaker who's not going to give you a vote on this ACA extension.
That's a failure of leadership. I mean, we have, members on both sides who believe this is an urgent issue, and it is for all of our members in terms of what their constituents are going to have to deal with in the start of the new year. So what's wrong with having a vote?
You have two leaders that are not serious about solving this problem.
You sound pissed.
I am pissed for the American people. This is absolute bullshit, and it's absurd. These premium tax credits are going to expire at the end of the year, and it has a direct impact on millions of Americans. This is not about party loyalty. This is about doing the job I was elected to do and forcing the body to actually work.
All right. Johnson, though, is insisting that everything is fine.
Have you lost control of the House?
I have not lost control.
Because it's the third time.
There are many. We have the smallest majority in U.S. history. Okay? These are not normal times. There are processes and procedures in the House that are less frequently used when there are larger majorities.
All right, Lance, to you. Clearly, Lawler especially sees that people are going to be pissed when their premiums go up and be pissed with the people who represent them. Is there an argument here that this is way beyond politics, that it's going to hurt Republicans, but that this is ultimately going to hurt the American public?
Yeah, look, I've been clear time and again. I think this is an issue from the sub. Well, let's back up. Let's remember why we have the subsidies and who put them in place. If we need to rehash it again, Democrats put these into place. They set the deadline for us all. So once again, it's on Mike Johnson and Republicans to clean up a Democratic mess. Now, here we are. Having said that, I think this is an issue we need to tackle. But I want to say something else about Mike Johnson. All this back and forth about him, I've said it once, I'll say it again. He's the most underestimated person in Washington, D.C. You look at it from the last year, he won the big budget fight and brought Schumer to his knees in the spring. He passed the one big beautiful bill in July, and he just won the government shutdown by keeping them out of Congress, out of session for 2.5 months. He's spent a lot of political capital on that, but guess what? The Democrats caved at the end of the day. So I think we need to give him some breathing room because, look, he has a very small majority and he has to tangle with a lot of different people. Now, what he usually does is he gives his members room to breathe and air their grievances. On this one in particular, though, I do believe Republicans are going to have to come out and figure out a way to address this subsidy issue one way or the other, even though it is a massive, massive giveaway to insurance companies. This 3-year package that these guys signed on to today, massive giveaway to the insurance companies. I'm not sure why Republicans would support it.
Go ahead.
I don't disagree with you in terms of Mike Johnson and the way he can navigate. I don't think he is a terrible speaker. I don't agree with how he navigates, but he does navigate. I think that there's a couple things that Republicans are reading this. They're like, Obamacare is terrible. Obamacare is terrible. When you talk to voters and you ask them, take the Affordable Care Act away, they do not want it. Sure, improve it, but do not touch. When they realize Obamacare is the Affordable Care Act, they're like, leave it alone. When you talk to voters and you realize that their premiums are going to go up, their health insurance go up, they say, fix the problem. It can be fixed. This is going to be a really hard sell. And the reason why those 4 people on that screen that you showed broke with Republicans, because there is a midterm election, and they are in Pennsylvania, and they're not going to be able to gerrymander their seats into safety. Mike Lawler's seat is a new seat that was created with New York map. He is not safe. That is a contested seat. And so he's mad. Yes, I'm sure he cares about the American people having affordable health care, but he's also pissed because he does not want to lose his seat, and this could make him lose it.
Well, I would just say that I don't think Mike Johnson is a terrible speaker when it comes to managing this very small majority. He is a terrible speaker when it comes to being Speaker of the House as a constitutional officer standing up to the President of the United States. One of the reasons he was able to keep the Congress out for so long is Trump doesn't want the Congress to do much. He wants to run the entire show. And he has surrendered the constitutional authority. He and Thune have surrendered the constitutional authority of Congress. No president has tried to claim as much power without congressional involvement as Donald Trump. And Johnson has let him do that. Would Pelosi have done that? Would Sam Rayburn have done that? Would Henry Clay have done that? No. They knew they were Article 1 and stood up for the president. He doesn't. And that's one of the reasons he's in the place he's in.
Pelosi's been too busy making herself, hundreds of millions of dollars
The
trading
Speaker
on
of the House
inside
is the force to
information.
be
I
reckoned
mean, come
Wait,
on.
let me
He's
just
a
ask you
problem.
why we talk about all the time. Republicans always say, "Look, this is the Democrats' mess that they made." They
That is a fact.
That
That is
is-
not debatable. This is
Look, and
Obamacare
a lot
is
of
them.
people have issues with it on
Yeah.
both sides of the aisle. That is true. But I guess the question is then what is the Republican plan that you have had, I don't know how many decades, to come forward with to say, here is our robust plan. This is how it's going to work for you, my citizens.
Well, Sarah, I wasn't prepared to address decades, so I didn't
Not
have
with a
that on
couple
my
of
bingo
years.
card for tonight, even though I'm a Wall Street bowler, as you've advertised. I think the reality of it is, and this is part of what the president was addressing directly today, is that we have some systemic failures. We have some systemic inequities in our healthcare system that favor the insurance companies, that make the way the system works a cash grab, as you said, for the insurance companies. Companies should not be able to overcharge by thousands of percent consumers when it comes to prescription medication. We should not be reliant on China for 90% of the raw material that go into the medication that we need and use. And that became painfully clear during the COVID pandemic. And that's what the president's trying to say. It's not just about coming up with an alternative to the ACA, and we need one. That's why there's so much on both sides, right? We need one. But we have to fix the system too.
But
You
where
can't
is
just
it?
Band-Aid it.
Well, the House
with
passed a
with
package
healthcare.
just earlier this evening. I mean, the House did address the ACA and made some reforms
Well,
this afternoon. I
they're
mean,
not paying for the subsidy, so that goes
yeah,
away.
I got it.
Let-
I'm with
Let's
you.
be real. The Republicans have been bitching about this for as long as I can remember, and there is no real plan. There's not even concepts of a plan. But here's the thing. If you are one of the Americans that is on the ACA, one of the Americans that maybe has a pre-existing condition that's only covered because of the ACA, and you see your premium skyrocket 100, 200%, and you don't know what subsidies you're going to get, you really don't give a damn whether it's a Republican problem or a Democratic problem. You want it to be fixed. And let me tell you what's going to happen. Because I have been talking to people who have told me they're going to go naked. They're not going to have health insurance because they can't afford it.
A lot of people
That
like
means, and this strikes home to you, strikes home to me because we've suffered with cancer, our families. It means that instead of finding cancers at stage 1, people are going to find it at stage 4. It means that instead of having treatable cancers, they're going to have cancers that are not treatable and they're going to die. So if we don't get this fixed, and it is negligence, it is inhumane for Mike Johnson to be sending Congress home at a time when we don't have a solution for this. The open enrollment ended 2 days ago if you want to have health coverage starting January 1st. I am not going to call him a good speaker when he's doing what he is doing today, sending
but-
Congress
And
home
it also-
when there is such a crisis for this nation
Oh.
that remains unsolved.
The subsidies are a crisis for the nation. I mean,
Rising
we would, if Obamacare was doing wonders, we wouldn't have needed subsidies in the first place. That tells you how bad Obamacare is.
That would say the President
The
Trump's
premium
credibility on
going up
this.
and there are no subsidies is a crisis for the
Well,
nation.
President Trump's credibility on
Jerry,
this
go
is
ahead.
very, very bad. Jim McGovern, the congressman from Massachusetts, stood up on the House floor today and he read all the times that President Trump said, we will have a plan soon, pretty soon, within the next 2 weeks, within the next 4 weeks, by Sunday, within the next month. And there were a dozen. It took me 3 or 4 minutes to get through all the times President Trump has said, we have a plan. It's going to be amazing. And I'm announcing it at the end of the week. I'm announcing it next Sunday. He's a flim-flammer on this issue. He doesn't care about it, apparently, to get anything together. And the Republicans don't have a coordinated strategy on one of the most important issues.
Yo,
in American life.
Obamacare became the law in 2011, 2014. It is 2025. It has been 11 years. Where is the plan if Obamacare is so bad? Republicans have voted on it 63 some odd times and without any counter, and it's failed because why? Actually, Obamacare is better than what it was before. I also think, to your point about catching cancer at stage 1, I've been sitting at this table before where they say emergency rooms are flooded with people who don't believe. You know what an emergency room looks like when people don't have a primary care physician to go to when they have a cold to get a prescription and they have to go to the ER? How hard it is for nurses, for doctors to actually give quality of care when they're already overtaxed, overrun, and then the bill you get when you leave the emergency room. My mom was in the hospital and her roommate was a Trump voter, and he wanted his wife had a stroke, and he wanted his wife to leave the hospital and they were on Medicaid because of how much the hospital was going to charge before Medicaid even kicked in. These are Ohio voters. This is Trump country. This is a crisis
Let me be clear.
beyond Obama.
None of that's okay. None of that's okay.